So today's topic was cirrhosis, right?
Cirrhosis.
But before studying cirrhosis, we have to see the structures and the location of the liver.
Yeah.
Because
Yes.
cirrhosis is related with the liver, so first of all we have to see the location of the liver. We said that the liver is located in our abdominal cavity in such a way that it is on one side it is related with the cardiovascular system.
Yeah.
On one side it is related with the cardiovascular system. And on another side it is related with the digestive system. So it has a very strategic position in our body.
Yeah.
And then after that we have studied the different functions of the liver. That the most important and number one function of the liver is metabolism. Metabolism of what? Carbohydrates, lipids, and proteins. Then another function of the liver that it produces bile. It produces bile. Then it also produces different types of protein. For example, blood proteins, including fibrinogen, albumin, and globulin. Then another function of the liver is detoxification. Detoxification means that it removes the different types of drugs out of our body.
Yes.
That is called detoxification. And another function of the liver is that it has some immune function. It has some immune function by some Kupffer cells which are found in the liver.
Yes.
They produce immune function. Then after that we have studied the cirrhosis. First of all we have studied the different causes of the cirrhosis. Then the number one cause of this cirrhosis was hepatitis. Mainly hepatitis B and C. Mainly hepatitis B and C. Then we studied the second cause was alcoholic liver disease. I think this is very common in China. Right?
Yes.
Very common in China. Alcoholic liver disease. Then we studied the cholangitis. Cholangitis means infection of bile duct, common bile duct or bile duct. Then we have studied that there are some autoimmune diseases. There are some autoimmune diseases in which our immune system attack the liver. Which our immune system attack the liver. Then we also studied, which was you said that in China it is very common, like blood fluke.
Yes.
Right? Blood fluke which can travel into the liver and cause cirrhosis. After that we have studied the different signs and symptoms for the liver. First of all we said that if the liver develops cirrhosis, then it will lose its all normal function.
Yes.
It will lose its all normal function. First of all, if the liver cannot metabolize lipids and proteins, then what will happen? That the patient will feel weakness and loss of weight. Secondly, we said that if the liver cannot metabolize carbohydrates, then what will happen? That our body cannot control glucose level, and there will be blood glucose level disturbance. Sometimes blood glucose level go very high, sometimes go very down. So there will be disturbances. Then we also said that if the liver cannot produce bile, then the patient will develop jaundice. And what will be the sign and symptoms for the jaundice? Yellow sclera and yellow skin all over the body. These will be the symptoms of the jaundice. Then the patient will develop bleeding. Then the patient will have edema. Because this through the portal vein, the blood is not going to the liver, so there will be portal hypertension. And due to this portal hypertension, fluid go out of this portal vein and develop into the abdominal cavity. And this fluid which is accumulating in the abdominal cavity, that is called ascites. That is called ascites. Then because of the portal hypertension, the back pressure will develop.